Hello, everyone. We want to welcome you to our annual Faith Summit that will discuss the topic of HIV in the community, in the Black community. Now, as you know, um, religion has been a source of strength for many in the Black community, providing guidance on faith, politics, and social issues. But among these issues, HIV has remained a crisis in states like Georgia. So, despite medical advancements, HIV disproportionately affects our community. African Americans represent 33% of Georgia's population, but accounts for 71% of HIV diagnosis, according to the Georgia Department of Public Health. The Black church, which has long been a historic mainstay for African American empowerment and well-being, has the potential to be a powerful public health partner for HIV prevention and to help dispel harmful and inaccurate HIV information. And so that brings us to today. To help us talk about this today, we have the founder and president of Sister Love Inc., located both in Atlanta and where she's currently located right now in Johannesburg, South Africa, Dr. Dazon Dixon Diallo. Welcome, Dr. Dixon Diallo. And we have
Thank
from
you.
Atlanta.
Well, sorry, I was so excited just to be here. It just caught my tongue. Thank you,
That's
Will.
all right.
To be here. I'm really excited for our first Faith Summit, first annual Faith
First
Summit.
annual. That's
Welcome,
right.
everybody. Welcome,
That's
everybody.
right. Also, we have Elder William Francis, the apostolic leader of Lives and Souls Global in Atlanta, Georgia. We want to welcome you both to our first summit today. And I'm William Settle. I'll be the moderator today, and I am a part of Sister Love as a member of the development team for Sister Love Inc. And we are pleased to have such dynamic individuals today to talk about HIV and our community, especially with the Black church. What I'd like to do is just say that the name of this first session is called Empowering Change, HIV 101 Dispelling Myths and Stigmas. So what I'd like to do is I'd like to just start off just some general conversation. As a people, we have been impacted by a number of things. You know, the historical events such as the Tuskegee experiments, we all know how that went, how it not empowered us, but how it brought about a lot of distrust in the medical community. You know, how do you think that has impacted us as it relates to HIV today? And Days, I'd like for you to start off with that, please.
Wow. Well, it's a really great way to start because it's actually what, I love to call a Sankofa moment, right? It's about remembering where we've been, giving ourselves permission to go back and look at it, regardless of how ugly, painful, or even triumphant, whatever it is that it was, and to learn from that so that we know, one, how to be in the present around those issues, but also how we know where we're going. And so thank you for the question, because I think I have a teeny bit of a different take on how we talk about Tuskegee and its impact and its continued impact and potential implications for the future of Black folks in healthcare, in engagement in our own healthcare, but also in medical health and policy, but also in the field of research, especially regarding HIV treatment and prevention wise. So the thing about Tuskegee that I think is always the most important to understand is that it was an actual study that was done in the course of its own time, which was in the middle of Jim Crow era, right? So why would we expect the science, including Black people in that era, to be kind, what are the 3 tenets of research now? To be respectful and to be beneficent and to be just. That wasn't going to happen. And so the lessons that we've learned from that is that even in the field of research, Jim Crow had a role to play, and it also had to be dismantled. And it had to be dismantled with whistleblowers. It had to be dismantled with truth tellers. And it also had to be dismantled with transparency in research. So there's a lot of pain, there's a lot of reparations that are still due just on that specific issue with regard to Black folks and our experiences, the men and their families in particular, but also those Black folks who were involved in the study, the healthcare, the fact that their work too was subjugated, right? That they didn't make all the decisions, they did the work, just like we do in a lot of places. What I want to remind people that we don't always know in community about this part of the conversation is that it is because of Tuskegee. It is because of Black people blowing the whistle on that situation. It is because Black people chose to figure out how to heal from it with policy and with justice. It's because of that in all federal research in the United States these days, and actually any research really, in good participatory practice as well, is that we now have institutional review boards. That didn't exist before Tuskegee. That means communities, researchers, and scientists come together to determine what the beneficence and what the potential pitfalls of a particular type of study would be. That's because of Tuskegee. We did not have necessarily DSMBs, data safety monitoring boards. Those are now boards of experts and professionals that take a look at the study as it's going to determine, is it futile? Is it working? Is it helpful? If it's helpful, then y'all need to stop this now and figure out how to get it to people. And if it's not helpful, if it's actually dangerous, then you need to stop this now and figure out a different way to examine your particular product. So that's because of Tuskegee, Will. And I could go on and on and on, Will times two, by the way. I could go on and on about the things that we have learned and have put into place to protect people who participate in studies. And we're still building on that. We're building on the language that we use, right? We don't talk about people as subjects. We don't talk about trials participants. These are people who participate in studies, right? We want to make sure that when studies are done, is that the community engagement structure is also robust, so that communities themselves are directly involved in understanding what the protocol is, what the trial is meant to be, or what the research design is, who's included, who's doing the work, and most importantly, what are you going to say to us about us when the studies are finished? How are you bringing that back to our communities so that we can say whether or not what you questioned is something that we really needed to understand for ourselves and our communities? So I know that was a long treatise, but really, that's the conversation on Tuskegee that we rarely have, which is it's because of the traumas that were imposed on Black people during that study that we actually have justice more than we did before. Not perfect, not close to where we need to be, but we are certainly much further along in protecting people and including people in the right way in studies these days. And HIV has led the way in making sure that that has happened.
Absolutely, absolutely. Pat, Elder, what are your thoughts?
Yeah, Dazon had a mouthful because, like you said, that's a whole conversation within itself, because you're still hearing, the distrust from public health. And I think the challenge is that those conversations aren't had with the people, right? I have heard that conversation because I sit in that space. That hasn't been brought, especially to a level where people understand it, right? You look back at COVID, right? There are still people that swear vaccine is killing Black people, right? Yeah. I mean, and they didn't get it from a reputable source. They just heard it over and over and over, and it became a reputable source. So it's been kind of interesting, even in the field of HIV, HIV being man-made, it's targeted at Black folks, different things of that nature. So there's a lot of stigma. There's a lot of myths that we have to overcome. And I just think as public health professionals, we have to get in community, build trust, and allow them to ask the questions that need to be asked, and then explained on a level that can be understood. But I really think it's about relationships with public health, from county to CDC, state. We don't have those relationships within the faith-based space and community space.
So how do we get those relationships together? How would we do that, Elder? What are your thoughts on that?
Yeah, I've been asking for it forever and amen, and it just has not happened. I don't know if that's
Mhm.
capacity, because a lot of times when they do come into a space, they're talking at such a high level. They're
Mhm.
using a lot of acronyms. They're losing a lot of folks. You got to get folks that, one, look like us, right?
Mhm.
Talk like us and live among us, right? To build the
Mhm.
trust, build a consistency. But a lot of times when you hear from DeKalb County or Fulton County or any Board of Health or the CDC, it's in crisis mode and we don't have the information. You need to take this vaccine to save your life. Oh, wait a minute. Here we go
Mhm.
again, to
Mhm.
Dazon's point. Here we go again. And they go back to Tuskegee. I heard that 18,000 times doing COVID
Yep.
work. I was like, I got it, but it was like, but they weren't educated. What
Mhm.
they heard, unfortunately, they got on social media from some resources that just weren't, relevant. They were giving misinformation, etc. But we have to start getting in community, and we need community liaison folks that are
Mhm.
in community, like in my community. I want to be able to see that person at church, at the supermarket, at the ball games, etc. And that's how we build trust. And it
Yep.
can be done. I think our organization has done a great job of doing that in the population that we serve, to get them to take COVID tests, to get them to do STI, HIV tests. But it took years to build that trust and relationship.
That's
Okay,
absolutely right.
absolutely. Yeah, and I definitely saw it during COVID. I
Mhm.
watched a number of sites where the vaccine was being given out, and in at least two sites around Metro Atlanta, one in DeKalb and one in Fulton.
Mhm.
I noticed it took at least a couple of weeks for Black folks to show up to get the shot,
Exactly.
and there
Exactly.
was a lot of discussion and a lot of talk about it. So you are absolutely right. You're absolutely right. Well, how do
Mhm.
you see the church as an advocate and support system for making this change?
Whew.
What role can the church play?
There's a whole nother workshop. So you said earlier that the church has been in the forefront of a lot of the issues that we've had around social justice, et cetera. But the church has also caused a lot of harm, and I think
Mhm.
that's the elephant that's in the room. I
Mhm.
literally just posted this morning on Facebook that our problems within the world and in our community need more than just a sermon, right?
Mhm.
We have to learn to be the hands and feet, right, to get in community. The successes that we have had with faith-based organizations, they know about HIV, but will not talk about HIV. If they allow you to do an HIV test as part of the health fair, you're put on the North Campus,
Mhm.
way over there to do the HIV test, right? You can do diabetes, you can do blood pressure, you can do vision, you can do dental. But HIV, you got to get on a bus and go to North Campus, knock on the door, go in the basement, and somebody will let you in the secret door, right? So we have to do a lot better, just making HIV testing, screening more routine. And there are a lot of churches that are doing some great work around HIV, condom distribution, different things of that nature. But I think there's three types of churches that we're talking about. There's what
Mhm.
I call high steeple, mid steeple, and no steeple, right? Your high steeple is going to be like your mega churches, right? They're normally not going to do HIV testing, but they can do policy work, right? Because the congressmen, the senators are going to them to get
Mhm.
votes. They have that ear. Your mid
Mhm.
steeple church, I think we do well in doing HIV testing and getting folks to volunteer at HIV events because they're a younger congregation. That's that age bracket that gets out and wants to do. Where we need the resources are in the no steeple churches that are in the community.
Mhm.
It's, Mother Bishop Apostle at Church of God in Christ on the hill around the corner, right? She may only have 10 members, but she's doing the work. She's who
Mhm.
gets the calls when the children are sick, when they need diapers, HIV testing, taking care of folks that have been diagnosed with HIV and really doing it with no budget, right? So I think we have to just figure out what the ask is of those three type of churches. And
Mhm.
I have heard from faith leaders that said we are not in their face, like say American Cancer Society or some of the other American Lung Association, different things of that nature. We're not in their face. They
Mhm.
Mhm.
may get one or two mailings a year about HIV, World AIDS Day, and starting to get Faith and HIV Awareness Day, and maybe testing. Those have been the two. But other than that, they really hear about HIV. So we got to get in the face of faith leaders, put it on their desk, and make sure we get it on their calendar and on their outreach schedules.
All right. You said get in their face.
Yes.
What do you propose? How do you propose we do that, Elder?
Well, we have to have, there is only one brochure, and I wish I had it today. There's only one brochure that's targeted to the faith community. And I think that was written, Dazon, how long have you been doing the work?
Oh, Jesus, 37 years.
It was probably written before you started.
Yes, when they had that little faith in the church, faith, HIV in the faith community back in the day.
Somebody need to update that particular one. So, I mean, we need the resources for faith, and not just a Christian church. When we talk faith community, I'm speaking from a Christian perspective, but from the faith community, Black folks are of all faiths, right? So we really need a campaign. There was actually one that was done around COVID that represented all the faiths. I thought the marketing materials that they put out was excellent. We just really need to recreate something like that for the faith community. And most people think that HIV has been cured. I mean, it's you'd be surprised. Like,
it is not.
Yeah, people living longer, and but it is still very real, and in the communities, where most of these churches are located. So, but I think campaign and the resources would be where I would start.
Well, that brochure is something I think you can probably help. Maybe Sister Love can take the lead on developing. Dazon, what do you think about that?
We're happy to do that in partnership with them that know. So I'm excited about the concept of that, and we definitely have the type team that can do that kind of communications work. I mean, it helps. I'm going to lift her up because she's coordinated a lot of this for us today. Sybil Miller, who is not only our VP in Programs and External Affairs, but our Director of Communications and a PK, right?
There you go.
She's
right
in the church and has brought this to not just to our awareness, because Sister Love has been struggling, for the 30 plus years we've been around because we're sex positive, because we are focused in on sexual health and well-being of everybody, inclusive of anybody who is of the faith or of a faith. And so one of the things that I have a question about, Elder, I'm one of those that gives my disclaimer all the time. I'm the happy heathen who prays. So, so I don't proclaim to know a whole lot about the traditions, but what I do know is that whether you're in the faith, whether it's the church, the mosque, the synagogue, or, the no steeples, wherever we meet, that we all are living intersectional lives.
Yes.
And I argue consistently that especially the folks that are of interest in Black communities to us, our lives are so intersectional that our responses must equal that intersectional challenge, right? And so I'm wondering how looking at stigma and looking at some of these other myths and things that exist out there, how do we dismantle some of that through an intersectional lens? How are we looking at sexual and health well-being in the context of relationships, in the context of community connection, in the context of community education? We don't need to only talk about sexual health, comprehensive sexual health education in the schools. We need to be talking about community-based, community-led, comprehensive sexual health, so that there's a way to talk about it in the church. There's a way to talk about it in the stores. There's a way to talk about it at the park. There's a way to talk about it in our external social engagements and community engagements, because I don't trust the school system to get it right anyway. So to do it in community by community is a different thing. And you're not going to do it if you're not addressing where people are also concerned about their heart and about their sugar and about their cancers and about their livers and about all of those other things that, by the way, if you happen to get HIV, the medications you take, you will have concern for all of those other issues. So this is really, really, I think, a different idea and approach of how to work with faith communities around being that intersectional response that people need, and not forcing them to wrap their arms around HIV, but really encouraging and moving people to another level of embracing the whole lived experience of every person that trusts and believes in them. So that's a question, and it's an idea that I think also can come through in literature, but also in helping people like Elder and all the pastors that you work with and all the faith leaders to have a different approach.
Right. And I think that's what it's going to take. We continue to do the same thing that we've always done. We always get what we've always got. And I think if you were to take what you just said and package that somehow and handed that to somebody that had, okay, so I'm gonna let you behind the curtain. As a pastor, I normally do what the pastor across the street does. Right? If we can get the pastor across the street to do it, we can get the whole block of pastors to do it, because they're not going to be one-upped. Right? So I think if we take what you said, package that, hey, this is what we would like to do as a model, right? Let's not lock them in for the next 6 months, 8 months, whatever it may be, just to see how it works. Because to your point, food pantries with medication, you can link that with the food pantry. There's so many, right? Here it is. And we would like to use your faith-based organization as an example. Christian pastor, a mosque, one on Glenwood, synagogue, Baha, etc., and see how those examples would work. Real simple, because all you need is a pastor to interject scripture, or somebody to interject something from the Talmud, from the Veda, from the Quran, or what have you, and there you have your model. And I think it can be a national model, but it takes the will and the way to do it. And I would be excited to work with you all to put something like that together. I'm especially just seeing Bryson and Sybil's work on the site promoting this event, something vibrant and something that speaks life, something that we don't have to be scared of to pick up and read and look at. So definitely you can count me in on that one, because it has to be done. Because our churches, when we look at HIV rates, where they're the highest, we have a church smack dab in the middle of that zip code, right? So we know HIV is in the community. Whether you talk about it or not, it's in your congregation because it's in the community.
Yeah.
Yeah. So, but that's exciting.
And I also think it's going to be what the younger population demands, right? That they're in a different generational space of where their information, where their knowledge, and the stuff that they trust and engage with comes from, right? And the more you're able to see all of the pieces that they see, then the more likely they're able to hear and see what we're saying. The other thing that you just said, Elder, that really resonated with me is that what all faiths do beautifully, whether it's from the scripture or the Quran or from the Torah, wherever, is use parables, use stories, use experiences, right? That are written. But there's a way to integrate everyday people's stories, even from that faith context and that faith experience. When I talk with women who are deeply children of God, deeply faith serving, and still want to be in love with somebody and want to be in a relationship with, and want actually to have some sexual pleasure in their lives, but not be denigrated, not be castigated, not be condemned for it, right? But done in a way that shows that there's a respect for their humanity and who and what they are concerned about. So I'm not trying to tell you what your risks are. I'm not trying to tell you what's wrong with your sex life. I'm trying to get an understanding from your own sense of faith and belief and practice as a human being, what it is you're concerned about. And then how do we have the proper response to give you comfort, to give you trust, but also to give you the support you need to take care of that.
Right.
Well, great segue, Elder. Sister Love has one objective today, and that is to save lives. That's what we want to do. We want to help save lives. Um, if we can utilize the church to do that, how would you recommend we do that? Because that's our agenda for today.
Mhm.
How
Mhm.
can how can Sister Love get into the church to help save lives today?
Right. It's interesting because our mandate, obviously, lives and souls, is saving lives, saving souls. And that saving lives piece comes
Hmm.
first, right? We do condom distribution. We do needle exchange. People have dogged me for doing it. It's like, okay, I can pray all day, but does that really feed this person's belly? Does it put clothes on their back? Also mandate, mind you, from our
Mhm.
scripture, but we sort of skip all of that. Right.
Hmm.
But it's about saving lives. So I'm definitely there with you. I think what we just talked about, and I'll be excited to get the recording and just sort of look at those pieces again. I really think putting together a model that our faith leaders can actually use. There's nothing out there that I have seen that deals with it from the context that Dazun just talked about. I think that would be very because it allows me, if I am going to have an issue with HIV, I have all these other things that I'm supporting, right? Right?
Hmm.
It's sort of like, a politician. Well, you want me to pass a tax bill, but I got to put some brakes in here for roads or bridges or whatever. So I'm voting for all
Right,
of this,
right.
and this one little line I necessarily didn't agree with, but that's okay.
Mhm.
So I think that would be a start. And then again, getting those materials. Like I said, there's in the Atlanta metropolitan area, there are some really, really, really strong faith-based programs that address HIV, but it's not a holistic approach, right? It seems to sort of stop with testing and then, oh, let me call Sister Love or another organization to link them to care. And that was but there's so much more. There's the counseling, there's the, constantly feeding of the dreams and the visions. A lot of
Mhm.
people, again, think, diagnosed with HIV, my life stops, right? But pastoral counseling, spiritual care, different things of that nature. I think also we have to train our faith leaders how to pray.
Hmm.
I I whew, I have been in some services and I've bowed my head and my eye came up like I gotta fix that because we want you to, and meant good, but
Yeah.
we want you to get tested today so you don't die of AIDS. It was almost there, but again, it's that mindset. They really thought they were doing well. Certain phrases that they used, not people first, language.
Mhm.
That type of training is going to have to take place, and I think it works well partnering with an ASO, CBO, and a respected faith leader that knows the lingo and how to go ahead and incorporate that. And we've done some great work around giving pastors sermons, different things of that nature for them to preach from. And with me going out, I have actually been amazed with the amount of people that come up after church and whisper in my ear that they're living with HIV, they have a son, a
Mhm.
daughter, et cetera, but have never told anybody within the church. And we have to we as faith folks got to better there because we have to
Mhm.
establish those safe spaces. So
Hmm.
yeah, so like I said, I would love to have the conversation outside of here, put some paper on the wall, old school,
Yeah.
and really
Yeah.
look at this thing holistically and put something together.
Well,
Yeah.
I too am a PK, and one thing that I've learned over the years is that community and
Hmm.
church go hand in hand.
Right.
And any way they can, get, the church in lockstep with the community is a plus
Hmm.
plus for the black community. Any
Yes.
day,
Yeah.
Yes.
any day.
Yes.
And social change and the
Hmm.
black faith community
Hmm.
go hand in hand, right?
Hmm.
So there wasn't a big question, even though there were maybe different approaches, especially during the height of the civil rights movement. There wasn't a question that the black church was in the leadership.
Right.
You
Right.
know, I mean, they
Right.
had Christian in the name, for Pete's sake, right?
Hmm.
Hmm.
So, I mean, between the SCLC and then you had the Nation of Islam and you had other faith groups, you even had Jewish people. There was a role clearly defined by faith communities for changing the conditions through movement,
Yes.
through unity, through policy, and through a different type of standing up for one's self, for one's dignity, and for one's rights. I would add a layer to this when we're talking about helping faith leaders pray. I would also want to help them how they redefine the way they do this work as a human rights body of work. That there's a human rights framework to how you can bridge faith and social justice, how you can bridge faith and HIV and sexual health, how you could even, if you took a rights-based approach, really move possibly some of those folks who are in the middle and the big steeples and the middle steeples to actually embrace things that they were antithetical to before because they thought about it so myopically. Like thinking of the rights of a human being who happens to be gender identified differently from what we think they should have been, or a person who is gay or bisexual or queer of any identity, or someone who has, putting in finger quotes, committed something that somebody might call a sin, when it takes a deeply Christian person like attorney Brian Stevens to tell us that everybody is more than the worst thing they've ever done. And so that kind of rights-based approach attached to the intersectionality of understanding who and where our people their lives are, I think we have a winning strategy, quite frankly. I don't know if it's going to happen immediately, but I definitely know it moves things and changes the trajectory.
And I've actually done, I think it was reproductive rights cohort with Sister Love.
Yeah.
Now, I will honestly say I came in on the border, wasn't quite sure, but I said I was going to be open, right?
Yes.
Changed a lot of how I looked at things, even being in the community. There was still, but getting into that space, having an open mind, just listening, because I can't act like I'm an expert on anything. I don't know, right? I listened, and that really began to change my mindset. And then once the mindset was changed, then like we weren't, and I'll use the needle exchange. We're not doing needle exchange. We are promoting drug use. That's sort of where I landed, and my board sort of landed there. And it took one person that said a clean needle saved my life.
Yep.
That hit. That hit. I had to go back to my board and say, okay, look, I get it. Let's just, and what we found, and by doing that, people were then coming back to us saying that they wanted to get off drugs. And now we have to go ahead and establish a relationship to get folks into rehab and programs, different things of that nature. But it took someone of that lived experience to just speak to me. And it was just that one, I cannot tell you the rest of that conversation. It was that one line, clean needle saved my life. I had no argument after that. And and people would actually come up to get the needles from me. You don't know how weird this is, getting clean needles from a pastor. I was like, well, think about it this way, how weird it is that a pastor is handing out clean needles.
That's right. That's right.
But prevented HIV, prevented Hep C, and went along with our work. And then as women came, we were better educated to deal with those issues because we were sort of just dealing with it as, everybody got sort of the same. But going through that reproductive health cohort with Sister Love really just helped us to look at it different. And now I'm like, if you can go talk to my wife or one of the other ladies, they have some different information for you based on what you have shared at the altar in prayer. If you've established that space or in confidence, we've been able to really deal with some issues that I think churches face, but it's not being said on Sunday at all.
Beautiful. That's beautiful. That's beautiful. That's where Sankofa meets our future, right? And so that's what I love about these conversations is that your own story is now a lived experience that was inspired by else's lived
Yes.
experience.
Yes.
That you
Yes.
can't beat that for
Yes.
anything. You just
Right.
can't.
Doesn't get any better than that.
And I think that the mistake we make is if William is stuck, right? That's where I'm stuck. We are not doing this. But if William is willing to pick up the phone and to call a sister love, that's a win as far as I'm concerned, right? Said we sort of want to beat folks over their head because they won't say, and affirming or inclusive or won't talk about this. But there are a lot of pastors that get folks to come to their church that call and like, I have no clue what to do with it. Can I give them your number? And, so I think that is still a win because we're able to engage in that person, right? That at least came to the church for help. It may not be that church, but having that network of churches helps as well. And then knowing the different agencies, CBOs, ASOs, different things of that nature, that can connect folks. When I call someone on a Sunday because somebody tells me that they want to get out of sex work or they want to get off I can't wait until Monday or Tuesday for a return call. I'm literally texting folks 11:30. I know you in praise and worship, but I need you to get your butt to Cleveland Avenue or meet me somewhere because I'm going to put this person in my car and this is what we're going to do. And it's those type of relationships that I think we can definitely build stronger and make sure that they're also interfaith as well, because I think, like I said, other faiths have a lot to contribute to this conversation, but they're not invited to the table.
Speaking of inviting to the table, Will, I think that what you also just raised, Elder, is the necessity and the critical role that our faith partners can play in ensuring that our organizations are as receiving and as open and as respectful in the way that's necessary when someone who has come to us because they approached a faith trust person.
Yes.
And that's helpful to us. When somebody comes to us and says, well, my pastor sent me,
right.
That's a different kind of conversation we may end up having about your testing, about your results, about what you might think of with regard to prevention. That could actually help us with the right language, with the right, not everybody at Sister Love is going to know how to start quoting scripture for somebody.
Right.
Shared some of that we should know and use for the right moments or the right people at the right time.
Right.
That's gold. That's the same thing as if a sex worker sent some of their people to us. We got to know how to talk to folks who work the streets, right? We got to know how to respect them as sex workers.
Yes.
And we can be using the right language. And what do we have to do? Ask other sex workers and what that needed to look like. Same thing, we did that for transgender men who have sex with men. Please come and audit all of our stuff for our language, for our approach, for who we sit in front of your people, making sure. And as a result, we have increased our staffing to include people who are faith leaders. We've included on our staff people who are trans experienced because we have learned the value in getting that direct advice, that direct critique, and that direct support for getting it right for all of different people that.
Yes.
Now that's how you save lives.
Yeah.
Exactly. It's very interesting. That's how this really got started. Dazon and I were at a Fast Track Cities meeting, I believe, at the mayor's office, and there was some testimony there that some people shared their experiences, and it had absolutely nothing to do with the Fast Track Cities initiative, but it just came up. And one person said, well, I had a talk with my pastor, and my pastor did an excellent job in helping me with my diagnosis. And another person said, well, basically, I had a conversation with my pastor, and my pastor didn't have a clue. And so from there, I said, that's where Sister Love should come in. We should be either the first point of referral or at least one of the points of referral. And so, Pastor, what I'm going to say to you is, we would like for you to help spread the word that Sister Love is available.
For sure.
We would love to have that be that person that you can call if you can't reach Elder Will Francis. Well, then try Will Settle, try Dazon Dixon Diallo, try one of us, so that we can get that or help get the conversation started about what needs to happen next.
Yes.
So we want to say we're here. We're here to help. And so we're going to offer that right now.
Amen. 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 Amen.
Absolutely.
Amen.
All right.
And
What?
and we're mobile.
Yes, Elder.
And that's major. That is major. I didn't know that. So I'm excited
Elder,
to hear that.
Elder. We're not only mobile, but we're mobile with a PA system.
Yes, we are.
Watch out now.
We have
Watch out now.
We have the new Sister Love mobile clinic.
Okay.
We can come to a church near you.
Okay.
That's right.
And
The
provide
Healthy Love
services.
Bus is ready to roll.
And
That's
call
right.
it the Healthy Love Bus.
Love it. Love it. Love it.
And it's the same color as Dazon's background.
Okay. Yeah, I'm definitely gonna have to see that. Definitely. Yeah, because we do a lot of community outreach events, and really everything has become mobile for us. So bringing in, Emory brings the dental folks have a mobile unit, so it's like a whole food truck look on one side of mobile stuff.
Look, Elder, we can talk offline about that because I absolutely have a fabulous vision for a pop-up parade. I want to see all the mobile clinics show up in parking lots and on streets, and I want food trucks, and I want high school and college bands, and I want a grand marshal, and I want people to come out and have fun celebrating their own health and well-being, whatever issues they're dealing with. HIV is one part of it, but the whole community's issues and concerns have to be in the mix.
Well, we will definitely talk. Our next big outreach will be, I should have these dates, but I know the week before Thanksgiving. And we sort of do that with the music and every vendor that you can service, etc. So I'll contact Will and we'll make that happen. And I love the parade idea. We need to do that. That'd be fun. Long as I get the baton.
Yes, sir. Yes, sir.
I need a baton.
The hi-hat. You gotta have a hi-hat.
All right, drum major. We'll give it to you, drum major.
Thing on, you gotta be the drum major.
I don't know how far I can lean back. But
well, you have time to work on it.
Well, all I know is my knees are not major enough for major Redding. That's for sure.
We will low step, not high step. We the low steppers.
All right. All right. Is there anything else that you think that we need to discuss today as it relates to myths and stigma in the church? What else do we need to talk about?
I really think that if we were to put together a campaign and the resources, all of those myths and stigma, and a lot of times people hold on to the myth and the stigma as an excuse not to do the work, right? And I've stopped trying to convince folks because as much time as I spend trying to convince somebody, there's somebody around the corner that wants to say yes and to do the work. And that's sort of where we have focused on. And like I said, there's several faith leaders in the Atlanta metropolitan area that we could sponsor breakfast and say, hey, look, this is what we're looking to do. And I truthfully believe that they would jump on. They would jump on and definitely, as you said, go through the material and, hey, this works, in my context, et cetera. But yeah, I mean, the myth about magic being cured and HIV is killing Black folk. Yeah, it is. It is. It is. I think we have to do a little bit better with the campaigns that come out because HIV is still targeted towards a particular community and not all communities. We can ride. I know Peachtree is not there anymore, but you ride down Peachtree and every billboard is targeting a particular community, which makes it even harder to have a conversation with a heterosexual woman or, so it's always other stuff that we can do. But I think this is a good start in having the conversation. And I think there's some benefit in conversation. We've literally laid out a national campaign within the last 35 minutes. And it's actually global because Izan's not here. So it's actually a global campaign.
That's right.
Right.
Yes,
and I'm all about let's doing it. We've been talking about it for 30 plus years. I'm about talking about it. I've been doing the work now since 2009, and I'm like, call me, let's schedule a meeting, let's get together, let's sketch it out, do what we got to do. Days, are you going to be in Washington next month?
I sure will.
I will find you. I will make sure I will find you, and
let's have that.
and yeah, and we'll shake on making this happen, and let's get it done. That's my thing, because the longer we take, the more lives we're losing. So
that part.
All right. Well, this is how you get it done. A global campaign has just been started.
Right.
All right.
I love it.
All right.
And Will, I just to comment, because every time Elder speaks, it just sparks so much, and I'm grateful for it.
Mm-hmm.
The stigma issue. I'm with you, Will. For me, the stigma is a Trojan horse, right? It is an easy, I don't want to use the word easy. It is an oversimplified way of trying to couch how people are treated just because they're different, right? That's not, so you can call it prejudice. That's something else. You can call it discrimination. That's the behavior that comes from stigma and prejudice. But stigma itself, if a Black person, you don't have to define stigma for me from an HIV perspective, because I get stigmatized on all kinds of fronts every day as a person living with melanin, right? And so, and visible melanin even more. And so the idea of reversing how we talk about stigma and talk a lot more about justice and how we are more human and in humanity with each other, I think comes through more when you're talking with people who are engaged and deeply involved in their own faith and faith practice, that I'm not finding all of the stigma solutions to actually change groups and change thinking. What I'm thinking is when you talk about the treatment of a people, right, and where the justice opportunities are. So what is it that I can do about how people are treated versus what the stigmas actually represent, which is racism? Y'all ain't fixing that for me in HIV. It's sexism, misogyny, misogynoir, homophobia, transphobia, poorphobia, or classism, whatever you want to call it. It's placing judgment on people so you don't have to treat them as equal. And we can shift that. We can shift that when we talk about justice and human design. So I just think that there are ways that my humanism can match up to anybody's faith to say the golden rule still matters. Every day. And so let's figure out how to help everybody, including our faith leaders, live it.
All right. Well, what I want to do, I want to thank you both. We are out of time for our session today. We have done a tremendous job. We've got a global campaign started, a parade. We're going to get the Healthy Love Bus out there with the speaker system. And so, but I really want to thank you, Elder Francis. Thank you, Dazon Dixon Diallo. And this is a great start to our first ever Faith Summit on HIV.
Bless you.
Thank you, guys.
Bless you.
I really appreciate it.
All right. Blessings. Be safe.
Thank you.